Hi, my name's Alina.
Hi, my name is Nurasnaya.
Hi, my name is Sirzan Gaire.
Uh, Cryptosporidiosis and ergot poisoning.
Cryptosporidiosis is a disease caused by the protozoan parasite Cryptosporidium. The full scientific name of the organism is Cryptosporidium paravium. As an apicomplexan protozoan, it possesses a specialized apical complex used for host cell attachment and invasion. Its infective stage is the oocyst, which is spherical and approximately 4 to 6 micrometer in diameter. The oocyst is thick-walled and environmentally resistant and contains 4 sporocytes that are released upon ingestion. In addition to the infective oocyst stage, C. paravium undergoes several intracellular developmental stages within the host intestinal epithelium, including sporozoites, trophozoites, merons type 1 and type 2, merozoites, and gametozoites, which facilitate both asexual and sexual reproduction cycles. Cryptosporidiosis has several signs and symptoms, but the most common and recognizable is frequent watery diarrhea. Symptoms are caused by the parasite Cryptosporidium, which causes cryptosporidiosis by traveling through the mouth into the digestive system. Other symptoms include nausea, vomiting, loss of appetite, or abdominal pain. If cryptosporidiosis goes untreated, complications can develop, especially in infants, pregnant individuals, and people with weakened immune systems. One of the most common complications is severe dehydration due to frequent watery diarrhea, which can lead to significant fluid loss and electrolyte imbalance. This imbalance can affect the function of the heart and other organs. In healthy individuals, the infection is usually self limiting and resolves within about 2 weeks. In severe cases, particularly in immunocompromised patients, death is possible. Although the overall mortality rate is low in healthy populations, but higher in those with weakened immune systems.
Some treatment and prevention for cryptosporidiosis is most effective and most important ones are good hand hygiene with especially soap and water, and because soap and water is best to prevent infections, and alcohol-based hand sanitizers doesn't help at all, like to prevent cryptosporidiosis or airline poisoning. Um, Avoiding untreated waters and avoiding unpasteurized milk and vinegar. Avoiding untreated waters because one of the ways to get these cryptosporidiosis is from pools and untreated water treatments. Um, and other treatments are effective antiretroviral therapy to gain immune functions for especially this is very important for especially immunocompromised people and um kids, um young adult young no kids, pregnant people, seniors who are whose immune systems are fragile. um Anti-infection drugs and antiviral drugs are used to treat and some NSAIDs. These symptoms also, um, um, antidiarrheal drugs help very much because of slowing down the diarrhea and like preventing from happening.
Cryptosporidiosis was historically underdiagnosed in the US due to the limited testing. Today, about 7,48,000 cases occur annually, likely underestimated due to underreporting. Incidence increased after the 1990s due to the improved diagnostic and surveillance. It most commonly affects young children, immunocompromised individuals, and the people exposed to contaminated water. So here is an example. So a major outbreak occurred in Milwaukee, Wisconsin in 1993 due to contamination of the municipal water supply with Cyclosporidium perium. About 4,30,000 people were affected and over 4,000 were hospitalized for severe diarrhea and dehydration. Severe illness and death were more common in immunocompromised individuals.
Some interesting facts about cryptosporidiosis are it is an auto-infection and the organism can infect itself without having to leave the host's body. Is the direct reinfection. It doesn't require immediate intermediate stage outside of the body, but it can also reoccur in someone's body. So if they are infected with the cryptosporidiosis from untreated water plants or from um, pools, etc., it can happen if the symptoms can reoccur in the patient.
Ergot poisoning is caused by accidental swallowing or eating of the ergot alkaloids toxin that is made by the fungus called Claviceps purpurea. It is a filamentous fungus that forms thread-like hyphae and grows as a mycelium on infected cereal crops. The fungus produces dark, hard structures called sclerotia that replace the grain and contain toxic ergoalkaloids, and it's responsible for the ergo poisoning. It also produces spores, including sexual spores called ascospores, which are elongated and released from sac-like asci, and asexual spores called conidia, which are involved in spreading the fungus to other plants. Ergo poisoning commonly comes from infected crops, pastured high agriculture produce such as cereal crops, more specifically wheat, barley, rye, etc. It does not spread from person to person. Ergo poisoning causes a variety of symptoms that are usually grouped into three categories: neurological, gastrointestinal, and blood vessel symptoms. Neurological symptoms affect the nervous system and may include dizziness, headaches, convulsions, psychosis, and coma. Convulsions are sudden and controlled muscle contractions, while psychosis refers to a loss of contact with reality. When ergot poisoning causes the nervous system symptoms, it is sometimes called convulsion ergotism. Gastrointestinal symptoms affect the digestive system and include nausea, vomiting, and abdominal pain, cramping, and diarrhea. These symptoms occur because the toxins produced by ergot irritate the digestive tract. Ergot poisoning can also affect the blood vessels because ergot alkaloids cause them to tighten for long periods of time, a condition called vasospasm. Vasospasm means that blood vessels suddenly constrict, which reduces blood flow and oxygen delivery to body tissues. This mostly commonly affects legs and feet, which may cause symptoms of coolness, paleness, and muscle pain. If ergot poisoning goes untreated, the condition can worsen and lead to serious complications. After the early symptoms, the heartbeat may be too fast or too slow. As the poisoning progresses, ergotoxins cause severe vasoconstriction, reducing blood flow to different parts of the body. This can lead to gangrene, where body tissue dies due to lack of oxygen in body supply. In severe cases, untreated ergot poisoning can result in permanent tissue damage or death. The exact mortality rate is not well defined today because cases are rare, but historically, during outbreaks, mortality rates were reported to be as high as 10 to 20%, depending on the severity and access to care.
Treatment prevention for ergot poison are um to prevent necrosis or activated charcoal and dopamine, like I activated charcoal, dopamine and antagonistic, antimicrobial medications, and surgical interventions. Activated charcoal, its ability is to absorb the poison from the and prevent it from going to the bloodstream and the whole body. Um, Dopamine antagonist blocks the effects of an alkaloids and reduces symptoms like hallucination, diarrhea, and increases body's dopamines um, to make to help the people or the patient heal better. Anti-migraine medications um, for help with the migraines and headaches. Um, and most importantly, surgical interventions can happen, especially if the parts of the body goes necrosis and gangrenes. It will cut off surgically the part that's from necrosis or gangrene, which is basically black, which is there's no, which is basically means tissue death.
Ergot poisoning was historically common in Europe from consumption of rye contaminated with Claviceps purpurea. It is now extremely rare due to modern agriculture and food safety controls, with most cases being isolated. Here I have this case report of ergot poisoning. So in 1951, outbreak in Pont-Saint France occurred after contaminated bread was consumed. About 250 people developed gastrointestinal, neurological, and vascular symptoms such as hallucination, convulsions, and vasospasm. Patients received supportive care including sedation and circulation support, and most of them recovered. The outbreak led to improved grain inspection and food safety regulation.
Some fact about ergot poisoning is it's a since it's a fungal infection. It the fungal infection starts in the soil, um, especially if it's grown in an environment that's hot and extreme temperatures. Life cycle of this infection is its first flowers and in the cereal plants barely and so healthy cereal or healthy plant replaces with the harmful toxic uh and the poisoning, which is the rain turns into black and it becomes toxic and it is known as sclerotia. Some safety regulations are met according to Rosal, Rosal and his friends. The lethal allowed maximum level of iron poisoning is 0.05%, which is if which is very small amount, but that small amount is so dangerous. Even though it is very small and tiny, it can cause very serious um, illnesses such as gangrenes, diarrhea, death.
Here are some questions for the class. You can pause the video and take a look at it.
These are all references, and thank you for listening to us.